All right, everybody, it's time for the technique of the week. This is egocentric work, usually used within EMDR, but you can use it with other modalities and with Christian and non-Christian clients. I usually use this when reprocessing a memory or working a client through a memory, and their reactions to the memory turn from emotional set reactions, like physical reactions and gut reactions and anger, all those kinds of things. I've even had clients in a fetal position because their trauma was so severe, and that's rare. It doesn't happen very often. But therapists should use discernment with this if it's too emotionally provoking. So say you're doing a 0 out of 10 scale, where 10 is neutral, 10 is hair on fire for the level of disturbance of that memory. I say anything 5 or higher, especially if you don't have specific EMDR training and you're using it in a different model, you should avoid this. If you're in EMDR, and this happens when it starts to scale down a little bit, like they're up at an 8, they're dropping down to a 5 because they've worked through some of this and that perspective starts to shift. We should be careful with Christian clients if we're inviting Jesus into these memories, because if they've had, say, spiritual trauma, church hurt, you could call it, it might be too much at that point, and you might have to do some other work ahead of time to help with healing before you invite Jesus into that. He's not the one who causes these problems. It's the church that does it, but he is represented by the church, and so it triggers a lot of people. Those who are not licensed in a particular state should not use this. If you're, say, a biblical counselor, if you do not have clinical training, you should not be using this technique. It is beyond your scope. This is for people who have clinical training and experience, and people who have EMDR training especially, but who have training in working with people with trauma. You need a master's degree from an accredited institution and a state license to do this work, or be a practicum, an internship under supervision. So what I do, here are the steps. I prompt the client with the 7 questions. What is the worst part of the memory? What emotion is attached? Where do you feel it in your body? What negative thought, that is cognition about yourself as you sit here now and remember, do you have? What would you rather think about yourself when this memory is redeemed? I like to use the word redeemed. We say reprocess through and it doesn't bother you anymore. How true does the negative cognition feel right now? That's 1 to 7. And 1 is completely false, 7 is completely true. Some people flip that and do that backwards, but that's the way I was trained. What level of disturbance do you feel right now when thinking about this memory? That is the 0 out of 10. Okay. Then you want to guide your client to enter into the memory. For non-EMDR clients, you can simply ask them to remember the memory like a movie. I just want you to remember what happened. I would recommend using a light butterfly tapping, nice and slow. Clients can do this themselves even when they're home, when a memory pops up and they need to work through it. Or you could simply take the person for a walk to increase their bilateral stimulation. Bilateral stimulation in general is healthy. We use an intense form of it within EMDR, but a nice light walk can help evoke some emotions and memories. If you're in an area where it can be private, there's a wooded area near your office, that sort of thing, you don't want to take this client out in public and be doing this kind of thing, or walking down the side of a busy street, because it's just not helpful. There needs to be some amount of privacy. Even if it's just walking the hallway in the office. If you have other clients coming in and out for other clinicians, then you don't want to do that either, because it affects their privacy. So be very careful with their privacy if you try something like this. You could get a treadmill in your office if you really wanted to and just have them walk nice and light, nice and easy, if they're capable. When the memory starts to shift from pain and fear, like we said up above, and anger, or I should say earlier, to sorrow and sadness. There's this definitive shift that happens when you're working through a memory, EMDR or other kinds of treatment as well. People come in one day and they're just like, I'm not mad about it anymore. I'm just really sad that it happened. Or it doesn't cause a physical response. I'm really have a lot of sorrow around this. It's a really neat moment actually, because they turn from bitter and seething to a point of forgiveness and sadness that this happened. At this point, I ask them to invite, if they don't want to do the Christian version of therapy, I ask them to invite the adult version of themselves into the memory. If they want the Christian version, we have Jesus come in. But first, the adult version, I will often have them step in and talk to the child from their current perspective and say something to the effect of, I'm here, You're going to be okay on the other side of this. We actually do pretty well on the end, provided they do. It hurts for a long time, but we find healing and it works. This was one of the things in my EMDR training, but this is really applicable in many situations. So getting ready to invite Jesus or the adult version of themselves into the memory, ask the client ahead of time what their preference is. Even if they're there for Christian therapy, I want you to ask them what their preference is. I want you to be really careful with this, just in case they have that church hurt or trauma. If they're not open to reintegration, we're going to ask the adult version of themselves in to the memory. If they are, then we'll invite Jesus. Just be careful. The adult version of themselves should enter into the memory, usually from when they were younger. So it's like the kid in the memory or the adolescent in the memory, and the adult version steps up into the memory. I remember an ad from several years ago where this kid's in front of the mirror and the adult version of himself pops in and he starts talking and telling him what his life's going to be like. It's an old commercial. And that's how I picture this. Is they talk them through, you're going to be okay. We get through this. It's really hard, but here's what life looks on the other side. I'm here to be with you right now and get you through this. It really helps people with perspective on this and understanding and healing. The Jesus version, I believe this to be a real authentic interaction with Jesus. I've been through this with clients dozens of times. They've asked for this, they've done it on their own, even when I haven't brought it up at all in many cases, or they just do it in the middle of reprocessing when we're doing EMDR. I simply tell the clients to allow Jesus into the memory and listen to him. Often clients end up resting in Jesus' arms as he reassures them that he's there in the hard times and the good times. Sometimes he tells them that he was protecting them from worse circumstances. I don't put that in their minds, they just do that, or that he was there even in the pain. Often he takes their pain, like they hand it to him in this memory, and they have a hole there, and he hands them something back, and it's usually just some version of healing. Like they do this on their own. I don't prompt them on this part. It's been really incredible to see the healing for people. Especially if this is a positive experience, allow them to sit with Jesus as long as needed. I have pictures in my mind of them sitting on a park bench with Jesus, his arm around them, whispering affirmations and truths in their ear. Let them sit there as long as they need to. And then afterwards, bring them out of the memory and reflect. Ask the following questions. What did you feel? Where did you feel it? What's different inside of you right now? What did Jesus say, or the adult version of you say? And what healing did you find? Then you allow that conversation to flow. And that's it.